Welcome to our panel today. The topic is plant-based diet, impact on health, the environment, and social justice. My name is Dr. Stacy Loeb. I'm a professor of urology and population health at NYU Langone Health, and it's an honor to have such distinguished guests here. Our program will begin with the keynote address, followed by a panel discussion and some opportunity for Q&A. As I mentioned, we will send a follow-up with links to resources and try to address anything that we do not get to on today's discussion. So without further ado, I would like to introduce our keynote speaker. Eric Adams is the Brooklyn Borough President, having previously served 3 terms in the New York State Senate and 22 years in the New York City Police Department. After being diagnosed with type 2 diabetes in 2016, he adopted a plant-based diet and successfully reversed his diabetes. So welcome, Eric, and I will pin you up now so that we can hear your discussion.
Thank you so much, and welcome to all of the participants in this Veganuary opportunity and event that we are experiencing, going vegan for the month of January. And it's always about starting the year off right. You have some amazing panelists, so I want to be as brief as possible because you are going to have folks on that I just adore listening to because they bring so much information and it comes from the heart. We're in a unique place right now as we look at what is happening in our nation, what is happening with the pandemic. I believe the universe in some way is speaking to us to tell us that if we're looking for different results, we have to do different things. We almost have to unlearn what we've learned so we can finally reach a point of learning. And nothing, I believe, personifies this more than chronic diseases. And you know, particularly those of you who are healthcare professionals, you're watching what's happening in our city and in our country. A chronic disease hijacks your life, and you're no longer yourselves. You no longer are able to have the productivity that you need to take care of your families and your business. You're thinking about it. You're thinking about the next test and how it impacts your family. And it just rips us apart. And it's unbelievable when you think about the fact that this thing that really controls our lives, we actually have input in a direction of it. And I didn't know that. I didn't know that when I was a police officer. I didn't know it when I was a state senator, and I darn sure didn't know it when I became the borough president. As it was mentioned, I was diagnosed with type 2 diabetes, and I just really thought this was the cost of living. It was hereditary, it was in my DNA, and since my mom was diabetic for 15 years and 7 years on insulin, just watching my dad transition from a chronic disease and my sisters and brothers all reaching this almost a rites of passage that once you reach a certain age, you're supposed to automatically start taking the same prescription, the same pills, the same injections. And this became our norm. And I could not tell you what made me go to the computer and become an explorer. We often look at the explorers of yesterdays, but we still are explorers every day. And just typing in one word different. When I typed in, instead of living with diabetes, I typed in reversing diabetes. And with that came an opportunity to step out of my comfort zone. I was experiencing vision loss in my left eye. The doctors just said, Eric, this is your new norm. You're going to go blind. And permanent nerve damage in my hands and feet, neuropathic nerve damage. They were tingling all the time. High blood pressure, high cholesterol. It was an ulcer that actually got me to the hospital in the first place. Like any other man, you have to drag us to the hospital. And I finally decided to go. And the doctor said, Eric, you have late stage diabetes. And it was unbelievable when I started to look at the power of food and reached out to some notable doctors who are now friends now, Dr. Esselstyn, Dr. Greger, Dr. Barnard, and others. And we were able to, after a consultation, they gave me information of going on a whole food plant-based diet. And 3 weeks after doing so, my vision came back. In 3 months, my diabetes went in remission, my ulcer went away, my blood pressure normalized, my cholesterol normalized. I dropped 35 pounds, and my body just felt amazing. Just the clarity in my thoughts, how I felt every day, starting my day, not being in prison by the overburden of food, and just the weight lifted off my shoulders of not having to figure out when I travel abroad, do I have my insulin? Where can I inject myself? Watching my mother do that for 7 years. And mom joined me at 82. Mom, stated that she was tired of living her life through a pill box. And I don't recall a day in my life that my mom was not in pain. My mom was not dealing with arthritis, high blood pressure, in the later years, heart disease, kidney failure, diabetes. And she joined me, in 2 months in, at 82, mom was able to cycle off her insulin and cut her 9 medications in half. And it just sent the right message as the matriarch of the family. My other siblings watched this amazing woman reinvent herself as an octogenarian and at a later years in life. And it just really crushed the belief that this was in our DNA. It's not our DNA. I say it over and over again. It's our dinner. It's not your lineage, it's your lunch. It's not where you're born, it's your breakfast. And the real crisis, I believe, in this city and in this country is that we are feeding the crisis. And we're in conflict in this relationship that we're having. And one voice, we want to fight childhood obesity, childhood diabetes, childhood asthma, yet every day we feed our babies the meals that cause childhood obesity, childhood diabetes, childhood asthma. We go to people check into the hospital for diabetes-related issues. And as soon as they get there, hey, welcome to your breakfast, lunch, and dinner. This is going to aggravate your diabetes a little more for you. This is not what we should be doing. This is a moment of reinventing ourselves. This is a moment of really unlearning what we learned so we can learn. This is a moment of a real movement of all of those amazing physicians who want wellness for their patients, but were denied the right to learn about nutrition in medical schools. We need to demand that we're given the real information to bring wellness to our patients. And don't kid yourself if you are in the healthcare profession. You are being traumatized every day that you watch a person come into your office 1 year only needing metformin, and then several years later, you're watching this beautiful family and patient traumatized because they go from metformin to insulin, to amputation, to blindness, to kidney failure. You may not realize it, but you are experiencing what I say is PTSD, because after hundreds and hundreds of patients following this decline, it impacts us all. We are connected. And this journey is not a professional journey, it's a personal journey. I want the moms of our country, the dads of our countries, the sisters and brothers of our country to know that we can live a healthier lifestyle. And it's not about immortality, but it's also not about just existing. It's about living. And I'm so proud. You're going to hear from one speaker today as I sum up Dr. McMacken and what she's doing at Bellevue Hospital with lifestyle medicine and using a plant-based lifestyle medicine agenda to have this foreign conversation that we've ignored, and that's disease reversal. And it's possible. I am living proof. It's not a fluke. It's not a one-time thing. This is something within our reach. And so do this for your family members. Do this so you can walk your children down the aisle and not have to be pushed down the aisle. Do this so you can enjoy your grandchildren and they don't see you as a burden on them because of the cost of healthcare. Do this because you believe in yourself. As we start the month of January 2021, this is the year of adulthood. We have to stop being juveniles and allowing ourselves to eat to live. Let's live to eat. A healthy diet in a very real way. That's the combination. As we eat to live, we should be eating to enjoy the health that comes with it. So I thank you for allowing me to come in. You're going to hear from some amazing doctors and other professionals. I'm just a person who has benefited from what they have done already. I thank them, and I want to continue to be as supportive as possible as we move in a veganuary. Let's try in a very real way on how to embrace less meat and more life. Thank you very much.
Thank you so much for that really inspiring lecture. That was amazing. So hopefully now we can have you on for a few more minutes as a part of our panel. I know that you're extremely busy as the borough president. I would like to introduce our other panelists. We have Dr. Michelle McMacken, who was just mentioned. She is an assistant professor of medicine at NYU Langone Health and director of the lifestyle medicine program at New York City Health and Hospitals Bellevue, where she is joined by Lilian Correa and Krisann Polito-Moller. Lily is a registered dietitian. Krisann is a health coach and certified yoga instructor. So what a powerhouse team there at Bellevue. Also joining us is Jasmine Leyva, who I'm a huge fan. She is an actor and filmmaker. She wrote the documentary called The Invisible Vegan, which was quite inspiring. And so we'll give her an opportunity to tell you all about that in just a minute. Also joining us is Dr. Columbus Batiste, who is a famous plant-based cardiologist and also co-director of the Slave Food Project, which we will hear about a little bit later. And finally is Yanoula Athanassakis, who is an NYU professor of environmental studies. She has written books and teaches a curriculum on veganism at NYU. So it'd be fascinating to round this out with some environmental perspective in addition to health. So let's turn to you for a moment, Dr. McMacken, just to respond to Eric's conversation about his diabetes and your own use of plant-based medicine in the care of patients. What kinds of conditions might this be helpful for?
Sorry, 10 months into the pandemic, I'm still on mute. So here we are. Thank you so much, Dr. Loeb, for having me on the panel, and Borough President Adams. I could listen to you every day and still be equally inspired. So thank you, and thank you for your kind words. Yes, so I just want to say that you spoke of your transformation. And I have also had both a personal and a professional transformation. So the first was the personal in 2007 when I decided to adopt a vegan diet. And I did that largely because of I had learned about sort of some of the things that go on in standard factory farming, and I wasn't comfortable with it. And I felt really good about the decision to go vegan, but I didn't know much about nutrition. We talked about how in medical school and in training, it's really not brought up very much. So it wasn't until I had already been a practicing attending physician for about 9 years that I attended a medical conference called the American College of Lifestyle Medicine. And it was there that I really learned about this unbelievable wealth of literature around nutrition science. And all of the many, many things that food has the power to prevent and in many cases actually treat. And this was a huge revelation to me because I had never learned any of it. And so I decided to pursue my own fellowship here at NYU in studying nutrition science. And I started incorporating nutrition more into my practice. And it was really amazing to see at Bellevue, especially where I'm treating a largely underserved patient population, seeing how engaged people were in talking about food and how they wanted to hear about what I would suggest and how they could incorporate things in their lives. And we strategized to help people have access to and pick healthier foods, especially a more plant-based diet. And at the same time, I was learning the nutrition science, which is, it's astonishing when you look at a variety of different types of studies. So big meta-analyses, randomized controlled trials, observational studies from all over the world. The theme is the same. It's consistent across all of these studies, right? You see basically when people consume more vegetables, more fruits, more whole grains, more legumes, more nuts and seeds, and they have diets that are low in meat, low in added sugars, low in highly processed foods, it's incredibly powerful for preventing disease. And it's also powerful for treating disease, people who already have diseases. So some of the highlights I'll just share. And I really want to start with a study that was one of my favorites ever published in 2016, which really looked at animal versus plant protein. And this is an important study because a lot of people, when they think about protein, they think about meat, they think about foods like red meat, chicken, fish, dairy, eggs. And what this study did is it really found that comparing animal versus plant protein, if people just swapped out 3% of their calories for the whole day and had a plant protein source instead of an animal protein source, so they're having more beans, more lentils instead of meat, they actually experienced, it was linked to a mortality reduction across the board for every single type of animal protein they looked at, whether it was processed meat, red meat, even some of the animal proteins that many people think of as being healthier, such as dairy, poultry, and fish. So the take-home message here is the more you diversify and move into the plant world for your protein, the better off you're going to be. And then we're talking about longevity. This is also really powerful for diabetes. And, I have a huge passion for preventing and treating diabetes. I literally think about it like 5 hours a day, and I treat patients with type 2 diabetes. And I have to say, honestly, I think very few things are more rewarding than seeing a patient come in with a new diagnosis of type 2 diabetes and telling them, I think if you're interested, we can talk about how you can leverage your lifestyle to improve your blood sugar. And not everybody is going to, wipe out their diabetes, but most people get much, much better. And in many cases, people can go into remission, especially if it's a new diagnosis. And I can tell you, there's really almost nothing more rewarding as a practicing physician than to see that, at least to me. And we also know in terms of benefits of plant-based nutrition that people with, there's a huge benefit in terms of preventing diabetes, about 34% across the board. There's a huge benefit in terms of cardiovascular risk reduction. Large studies show that on average, people consuming healthy plant-based diets have about a 25% lower risk of developing coronary heart disease. There's a lower risk of cancer in all, total cancer incidence, as well as specific types of cancer among people following healthy plant-based diets. And so, and plant-based diets are in line with all of the current major medical society recommendations, like the American College of Cardiology, the American Association of Clinical Endocrinologists, the American Cancer Society, the American Academy of Nutrition and Dietetics. And finally, I would add they're in line with the Eat Lancet report, which was published in 2019. And this is an incredibly important report that was published by nutrition scientists from around the world, looking at how can we best maximize individual human health with planetary health. And the answer, again, is shifting towards a more plant predominant diet, because it's easier on us as humans. It's kinder to ourselves, it's kinder to the planet, it's kinder to animals. It just really is a triple win, I like to call it.
Amazing. Thank you so much, Dr. McMacken. Let's turn next to Jasmine. can you talk a little bit about your documentary, The Invisible Vegan? Can you tell us about the inspiration for the title and what are some of the topics that you unearthed?
Okay, so I just want to say, like, I came into veganism for purely cosmetic reasons. I saw an older woman in booty shorts and a tank top, and I was like, I want that to be me when I grow older. And I asked her about her habits. She told me she followed a plant-based diet. So I was like, oh, that's what I'm doing then. And once I started, a lot of the smaller health ailments that I had started clearing up, you know, things that I thought, you know, not to overshare, but, you know, hemorrhoids, or, you know, I was told I had little cancerous cells growing. And so I thought these were just a part of growing pains. When I started following this vegan diet to look like this woman in the booty shorts, all of these battles started clearing up on their own. And then that was the aha moment, like, wow, this isn't just about being a size 6. This is about being healthy. Why aren't my doctors telling me that? When they gave me the choice, you know, to get a piece of my organ burned off or to take some medication, why wasn't I told that there was a healthy alternative that wouldn't do me any harm and bring me all these additional health benefits? So once I realized that, I was like, wow, a lot of people of color are not getting this information. And when I looked at all of the documentaries, which I love, you know, the Food Inks, the Vegucated, the Forks Over Knives, I love them. But collectively, I felt like, wow, there's usually always a white man at the center of the narrative. And if you keep putting the same people at the center of the narrative, then the same people will keep getting the message, which is not my people who are battling, you know, at disproportionate rates. So I decided to, you know, use my background in film production and put together a film that would be the change in the world that I want to see, if you will. And I picked the title, The Invisible Vegan, because I read the book, The Invisible Man by Ralph Ellison. And in the intro, he says, like, you know, there's an invisibility because he feels like he doesn't feel visible in all white spaces, but because he doesn't adhere to certain stereotypes, he also feels invisible in Black spaces. And that's kind of what I felt as a Black vegan. And then the fact that, you know, just visibility, it just seemed like a perfect title altogether for the film. So yeah, and in the film, I talk about how, you know, disease care over healthcare. I got a lot of strong voices, Tracy McQuarter, Dr. Milton Mills, John Sally. You know, I took this as an opportunity to show, like, hey, look, in health spaces, in vegan spaces, Black people, we're not just the tokens. We have a lot to contribute to this space. We've been in this space for a long time. Angela Davis, Coretta Scott King, like all of these people that we might not know of their choices, these invisible choices, but if they were put more in the forefront, you would have a lot more people, you know, with this skin tone saying, like, oh, maybe this isn't a white thing or elite thing or a Hollywood thing. This is something for me. This is something that can save my grandmother's life. So that was kind of the, you know, intention and history of the film.
Wow, really incredible. And it's just an amazing film. I've seen it several times. I know Eric has to leave us a little bit early, so I want to give him an opportunity to respond and also, you know, share his thoughts about plant-based diet and how that might help with health disparities in the Black community, or perhaps some of his initiatives surrounding Meatless Mondays in New York City schools and hospitals.
No, thank you. And I believe Jasmine's story just really resonates with me. You know, we talk about in the African American community, we talk about the Willie Lynch letter. It was a letter that a theme of setting in place how to program African Americans to really be at odds with each other throughout history. The real Willie Lynch letter, I believe, is embedded in the recipes. The slave owners turned over food that our ancestors had to use to survive. And that survival was handed down from generation to generation to generation. And it's almost unimaginable as I sat down around the table with my family members as we celebrated the holidays, and we prayed for our loved ones who were in the hospital. And we prayed for their wellness as they dealt with medical crises. And then we dug into, some of them dug into the food that caused the crisis in the first place. But we engaged in a real soft, meaningful conversation. And we started out as, well, Eric, you're trying to embrace this white thing. And once I was able to show the historical analysis of what this is about, they started to think differently, because you can't wear a Brooks Brothers suit and red bottom shoes and worry about everything external, but you're poisoning yourself internally. And it's about being real and honest, but kind and not mean. Because let me tell you something, a lot of my friends that are vegans are mean. And we cannot dictate and be abusive to people, because animals are living beings, but animals of humans are also living beings. And kindness is part of this conversation that is often ignored. And it's not about saying I'm better than you. It's about saying I am loving of you. And I want to give you the information so you can make the smart decisions how we live in this universality of being on this planet together. And so that's why we have the initiative in our schools. We were successful in getting our schools to move away from a processed meat, a type 1 carcinogen. We push Meatless Mondays in all of our city agencies. Our tax dollars should not be going to feeding the crisis. And we are pushing in place so many other initiatives. We have a great partnership with Downstate Hospital, where we're talking to the new residents about introducing plant-based living in their instructions, because Jasmine is right. I went to 5 of the best doctors in the city. The access to healthcare, as the borough president of the hospitals opened their best doctors. They all told me the same thing. This is your new norm. No one told me, Jasmine, that, hey, Eric, you may have to do this insulin thing to normalize your A1C, but if you change your lifestyle, you could cycle off of this insulin. Medicine normalize. Food ensure that we have a sustained life. No one gave me that information. So if I didn't get it, imagine Ms. Jones at 70 years old, coming from NYU development, afraid of giving COVID because she knows that she's going to die twice the rate of her white counterpart. Imagine a non-English speaker from Washington Heights who does not have access to healthy food, but nothing but fast food. What we are doing to everyday New Yorkers, particularly in economically challenging communities, is criminal at best. And so our initiatives here, Meatless Mondays, teaching children and young people the millions of dollars we put in schools to use hydroponic vertical farming. I believe we need to reintroduce an agrarian economy in the city. We partnered with NYU School of Business, Cornell University. There's no reason we can't start growing food right in some of the available building spaces now. We have to think differently about connecting health and what's on our plate every day. And so I'm excited about what we're doing. We are not going backwards. And I think partnerships like what we're doing today is so important. And what's crucial, and I know I'm just calling your name out so much, Jasmine, but you're so important because you are a credible messenger. And using your creativity to speak to young people that they can find is palatable is so important. And doing it in your creative way, I would love for you to come in and speak to a group of the young ladies that we have been speaking with so they can start seeing some of those health crises that they are experiencing, we are causing them. And your film, I think, is going to be one of many that folks are going to start really taking control of their health. That's what real Black Lives Matters mean. Not only Floyd destroying us, but our hospitals our medical facilities, our pharmaceutical industries, our food industries, our meat and dairy industry, our agriculture industry, all of them have their knee on our necks, and it's time to take it off.
Great. Well, thank you so much, Eric, for joining us. We really appreciate your time, and what a very powerful and inspiring message. Jasmine, I want to give you a chance to respond.
Thank you so much. I think we both are on the same page. Your message resonated with me as well. It was one thing that you said, a quote. I actually put it on my Instagram today. It was the foods that are supposed to be bringing us together are tearing us apart, one fatal diagnosis at a time. And like that really hit home for me, as someone who I did have the grandmother who had diabetes and high cholesterol, but yet we're still, at the table eating all of the foods that are putting her in this situation to celebrate, so it's time that we start actually like looking at how backwards some of these mentalities are and just, like you said, like trying to move forward and evolve into something different.
Well said. Well said. Thank you.
Great. So let's transition over to our next set of speakers to make sure everybody has a chance to go around at least one time. Let's go to next, Dr. Yanoula Athanassakis. Can you talk a little bit? I know that you teach in NYU environmental studies and you work on issues of environmental justice. Can you explain to us a little bit about what environmental racism is?
Sure, certainly. First of all, thank you so much to all of you. And that was such a nice springboard to have Eric Adams talk about Jasmine's work and the importance of voice and narrative, because I teach in environmental studies and in English, and my colleagues in environmental studies and in animal studies come from a mix of humanities and social sciences and sciences. And I think the differing perspectives are really important in these conversations about really complex issues. And one of the most important things is really shifting narrative and shifting language to be more accurate, or to more accurately and realistically reflect what's happening through our consumer choices and also through corporate behavior. So to answer the question, environmental justice, right, is this term that was spurred by the civil rights movement and Rachel Carson's 1962 book, Silent Spring. And I think something interesting here to think about and pause on is that both the EPA, which has not yet been dismantled, and the FDA, also not yet dismantled, were really in large part the outcome of works of creative nonfiction and muckraking journalism. And so there's this great importance that I would put on arts and science coming together to highlight stories that don't otherwise get told. And in fact, it seems that the most sort of successful stories are the ones that show or demonstrate to consumers the direct ways in which behaviors are harming them, right? So it seems to be that that approach seems to be the most successful. So the environmental justice movement draws attention to the often concurrent exploitation of nature and humans, and I would say increasingly also to species or non-human animals. And it's intersectional in the way that it often looks or connects environmental degradation to issues of race, class, and gender, and again, increasingly, I would say to species. And so oftentimes people point to Warren County, North Carolina in 1982 as the birthplace of environmental justice. And I just end there with the definition of environmental justice, because it's also where environmental racism sort of took the most wind in its sails as a term that's related to environmental justice. So one can work in EJ and not necessarily treat environmental racism. I think that increasingly needs to stop, right? So environmental racism is the racial discrimination, environmental policy making, the lack of leadership of people of color in the environmental justice and environmental movement. And it's really the deliberate targeting of people or of color communities and toxic waste facilities. So there's these sort of state and federally sanctioned decisions of expendable lives, right, and where they're located. And they're often located and stratified along lines of race and gender. And I think that needs to be more of a conversation that happens in discussions of environmental justice. And I know today's panel is on plant-based food and food systems. And so in terms of food systems, you not only have food deserts, which is a more commonly known problem, but because agriculture has been industrialized, whether it's animal or vegetable, some of its most polluting factories and facilities are concentrated in communities of color. And in addition, the workforce is fueled by the same sort of expendable lives, which is poor, undocumented workers and people of color. So those are the two really main issues that environmental justice, environmental racism can highlight in terms of food.
Thank you so much, Yanoula. I think that's really interesting. And, you know, it reminds me, maybe a few months ago, the New York Times ran a quiz, and it said, how many years would you have to live completely free of all packaging to have the same environmental impact personally as being a vegetarian for 1 year? And this is completely free of packaging, you know, not one single use plastic, no takeout food, no bags at the store, nothing, which is pretty tough. And it would be 11 years like that to equal 1 year as a vegetarian. So I think maybe we underestimate our own, you know, potential individual impact and contributions through the foods we eat. Let's shift over to Dr. Batiste. So I know in addition to your many prominent roles within the field of cardiology, you also are the co-director of the Slave Food Project. Can you talk a little bit about what that is?
Yeah, well, thank you once again for inviting me. This is a great panel discussion, and began January really looking at our health choices, you know, focusing on what we can eat for our health and what we can do for our health. But, you know, slave food was really born very similarly to what Jasmine mentioned and to what Eric mentioned, is that when I entered into this space to really incorporate this into my practice, which is hard as the interventional cardiologist, we get our bang for our buck by the complex procedures we do. So to talk about light and fluffy things like nutrition, it's a little bit, it was a challenge starting out. But one thing I recognized originally starting out was that it needs to be culturally specific. So not just African American, but Latino, not just Latino, but Asian, not just Asian, but specific to Filipinos and various indigenous groups. And so what was born out of that was this colliding of thought process with my co-founder and myself. And Slave Food is a project that looks at the intersection between stress, which we all face, physicians, and we're seeing it more than ever in 2020. It looks at the intersection of stress, racial discrimination, which is really this stress that you cannot absolve yourself from. As an African American, I can never, doesn't matter what title I have, what financial state I have, I can never hide from my skin. And that layered stress that studies have shown equates to disease. We look at that intersection, and then we throw in another layer, which is nutritional stress. Food that leads to harm within the body, and that collision that develops this thing called health disparities. And so inside of here, the title Slave Food came about because it's a double entendre. Yes, it speaks to the historical perspective in which indigenous people from Africa were brought over to various continents throughout the world by force, and where food was used as a weapon to keep them enslaved during that transport. Then we look at the migration throughout history. But here's the key. In the environments that we live in, we say oftentimes make better choices, but people are enslaved to their communities. That all around them, they live in areas in which there's fast food, in which there's food deserts, food swamps, and the cost of foods we know may vary and are set by the grocery stores. And so they're in fact enslaved by their environment as well. Another layer of enslavement is the fact that we become addicted to the food that big business and big food industry has constructed the food to make us addicted, to keep coming back through this surge that's there that somehow we can't get away from it. Another layer that comes in is the advertisement, that now we see this advertisement continue to layer, and that's targeted in certain communities of color at heightened levels that make them addictive. And now we develop this brand recognition that continues to cycle. And so Slave Food is really this project to bring awareness. It's not just about one thing. It's about our greatest enemy is the standard American diet of all forms, and trying to bring our attention back to eating food and activities that are going to build resiliency and diminish our stress, because our health equals our resiliency divided by our stress. So that's slave food.
Great. That's really amazing. Now, an interesting point that you mentioned that I want to follow up on is addictive food. And I know one issue that you've studied in your cardiology hat is meat and some of the substitute meat products. I know those are very popular and can be very helpful for people who are transitioning over to more of a plant-based diet. Can you talk about the cardiovascular effect of the meat substitutes as compared to regular meat? Are you still better off with a meat substitute from a cardiology standpoint?
No, that's a great question. And so that's a mixed bag of nuts, so to speak. When we look at meat substitutes, if you look historically, that really just doesn't pertain to our current state of the plant-rich burgers and alternative meats. We look at things like our tofu, we look at tempeh. These are historical replacements for meat that have been shown study after study to have beneficial effects on cardiovascular as well as for cancer mortality in many particular instances. When we look at our current compound, there's rare studies, but there are a few studies that are starting to look at it. The most prominent that comes to memory is the swap meat study that was done, a very small study, only about 36 patients out of Stanford, and they had them do a crossover, an 8-week crossover, and they showed a tendency towards an improvement in trimethylamine oxide, which we know is it highlights a risk of cardiovascular events and renal and so forth. Also showed a bit lower in terms of your LDL cholesterol, as well as a slight trend towards a reduction in the weight. So that's very favorable. And of course, it's important to bring out, it was sponsored by Beyond Meat, but the reports were that it had no involvement in the construct or the delineation of the study. But those sorts of conflicts are important to bring out. I think ultimately, both the beneficial effects on the environmental standpoint, as well as the importance of trending folks away from eating these standard foods, the standard meats, is important. And you and I spoke about this. I told you about my most important conquest ever. It wasn't about the patient who was symptomatic from angina and couldn't walk 100 feet. It wasn't the individual who lost 25 pounds over the holiday period just this past time. It was someone I was speaking at the Essence Festival, and we were driving around for about an hour in traffic. And I was trying everything I could to get him convinced to go plant-based. And he was like, no, I don't want to know. I don't want to watch anything, because if I know better, I have to do better. And I kept on. I was like, come on, the fruits, the vegetables, your son, your kids. He said, I'm not trying to hear you, man. And so finally at the end, I got him convinced to try one of these Beyond or Impossible burgers. That was the only thing. And I felt so proud that I got him to open that door to consider that there is a better option available for him. And that's really what it's about. It's about meeting people where they're at with love. And that's what Eric alluded to. Not with hate, not with judgment, but with love, and letting them know that, listen, one step to travel 1,000 miles is all we need to get going.
Amazing, thank you. One last question that came up for Yanoula. What is the impact of our diet on oceans and marine life?
Oh, I'm getting all the really cheerful questions here today. Thank you. So thank you, honestly, for that question. So the impact of livestock ag and simply industrial ag on waterways and marine life is just, it's not good. So you have the open air waste lagoons, right, that are the size of multiple football fields. There's runoff waste facilities that cause leakage and illness and death in both human and non-human animals. And that's something we often don't think about, is that human life is also affected. And industrial ag is a leading contributor, right, to sea temperature rise and ocean acidification. I know we all hear that all of the time, but if you sort of stop and think about it, if we're warming up the ocean, that means that animals that we're raising to eat, right, are then killing and affecting animals that we consider to be wild or wild caught. And so then suddenly those wild caught animals are also animals that we're choosing to consume in some way or another. And so there's a real question here about just that we're not in a closed system, right, in any way in our food choices. And that comes more and more to light in the different works that you read, whether it be the Eat Lancet report, which is a favorite of mine. I'm so glad it was already mentioned. And then the FAO-UN report, Livestock's A Long Shadow. And then if I can just say Food, Animals, and the Environment, which is published by two of my colleagues in environmental studies. There's a lot of data. I don't want to give information that's simply Googleable. And so what I would say is that, you have species extinction, oceanic dead zones, water pollution and drought. I'm trying to look happy as I say this, and habitat destruction, which are in direct relation to the impact of livestock agriculture on oceans. And so, you get a lot of questions, actually you as physicians probably get a lot of questions about subbing in a pescatarian diet for a meat heavy diet. And, my answer to that in sort of the research that we're doing on animal cognition is that I'm more troubled by the term seafood than I am by meat, and more troubled by the idea of seafood or sea animals being used in just this sort of catch-all phrase than I am by the idea of meat. And I'm talking about that more in a sort of, moral philosophy way and in terms of ethics, but it's because the dietary choices we're making really, the language that's used really doesn't reflect the reality of what's happening, right? So with this one term seafood, we're suddenly erasing thousands and thousands of different species, whereas on land we say, okay, I eat beef, which is a cow, I eat pig, or pork, which is a pig. And so there's these really interesting tensions there. And then aquaculture, something people often think is sort of removes you from a system of environmental degradation, is actually hasn't proven to stop fisheries, right? Which is, or the fishing industry, I should say, so that aquaculture hasn't had the impact that we had hoped it would have in terms of habitat destruction. And so I would highly recommend Ian Urbina's Outlaw Ocean. Just it's a really interesting read in terms of the Anthropocene and anthropogenic caused climate change and the twinned narratives of human slavery and animal, the impact on animals. So, the one thing I would just say is that the stories we tell ourselves about the oceanic spaces and terrestrial spaces in terms of, the food that we eat and what it means about who we are really out of sync with the reality. And so I'm incredibly interested, as are many of my colleagues in animal studies and environmental studies, in making the language, right, and the narratives more realistic, because then we know that all of the people that we know and love and are making choices about their food are really good people. And the stories they would tell about themselves is that they are. And so it'd be great to more synergistically link those choices with the great other choices that we know they make in terms of sort of ethics and morality. And I'll stop there.
Thank you so much, Yanoula. So finally, we want to end on a positive note. I'm sure everybody feels very inspired with these fantastic speakers. So I want to give a chance for Lily, who is our registered dietitian, and Krisann, who is a health coach from the Lifestyle Medicine program at New York City Health and Hospitals, to give us some tips for how can we adopt a healthy plant-based lifestyle in 2021.
Hi, thanks, Stacy. So Lily and I have compiled our best top 10 steps to share with you. So number one is find your why. Find what really makes you tick within the vegan community. Is it health? Is it animal agriculture? Is it the environment? Really connect to that and learn more about it. And it will help you through those times when you're just getting started.
Number two, create team around you. So creating support around this journey isn't just key, it also makes it really fun. So find a buddy, maybe create a plant-based challenge in your workplace, engage your family in trying new recipes with you, or join some online communities. Here in New York, for example, we have Plant-Powered Metro New York, which is an organization that really hosts a lot of great educational events, cooking demos, and support groups all online. So just know that you're not alone.
Number three, Holy cow, Happy Cow. If you've heard of the app Happy Cow, it gives you the vegan restaurants that are local to your location, wherever you are in the world, not just our country. So it's a great way to really help the establishments around your local vegan establishments around where you live or you're visiting. And it's a great way to get takeout, and it's a great way to try some new cuisines or some new dishes that maybe you don't feel as confident into cooking yourself.
Yeah. Number 4, everyday plant-based. So think of the foods that you already eat that are already plant-based. Maybe you just don't call them by that name. So pasta primavera, peanut butter and jelly, bean burritos, arroz y habichuelas, or rice and beans. So don't sweat it. You're probably already halfway there.
Number 5, plan on it. Plan what you're going to eat for breakfast the night before, what you're going to have for lunch at breakfast, and what you're going to have for dinner at lunch. It's really a good idea to have some go-to things in your pantry, like canned beans, frozen fruits and vegetables in your refrigerator and freezer, and baked potatoes already cooked on hand. Some people like to meal prep and cook all at once on one day. Some people like to have a great grocery list and have recipes. And some people really like to plan it out for a week. Try it different ways and see what works for you.
Number 6, give your faves a makeover. So you're used to having scrambled eggs for breakfast? Why not try tofu scramble instead tomorrow morning? So season it just like you would your eggs, add some spinach, add some red peppers or colorful peppers, add some mushrooms, and you got yourself a breakfast. How about if Taco Tuesday is a family staple? So what about trying tempeh instead of ground beef? And also setting out, again, another array of vegetables, to pick through for the fillings. Or if yogurt is your breakfast of choice, why not try overnight oats? Get your mason jars, set them all out, put a variety of fruits out, nuts and seeds, maybe some almond milk, put them all together, put them in that jar, throw them in the fridge. Tomorrow morning, breakfast will be served.
Number 7, nerd out, like completely nerd out. Watch The Invisible Vegan. Look on the internet for slave food. Look up your favorite chefs. Look up some recipes. Follow some social influencers that really connect to you, like Tabitha Brown or Plant You. There's so much information, and I'm sure you can find one thing that really lights you up. Maybe you love to cook, find some great chefs, vegan chefs. Or maybe you really like to talk about animal rights. Find some really great activists that you can follow and really get involved.
Number 8, think addition, not subtraction. So anytime that you add, let's say, vegetables to any meal, you're increasing that meal's nutrient density, or the amount of vitamins, minerals, or phytonutrients, which are plant compounds that act as antioxidants. So when I have patients often come into my office and tell me, well, I just don't know how I'm going to do without A, B, or C, right? And then I think, well, most of us, on average, we rotate 5 to 6 different dinners every week, right? And when I became plant-based myself, as I started to research more recipes, I started to really get out of that monotonous world of the routine that we create for ourselves around meals, and just open up my eyes to this colorful variety of vegetables, legumes, and fruits that I had never tried. Maybe I just walked by them from the farmer's market, right? So get ready for a culinary adventure, because this is what I always try to create with my patients, right? Think of a world of abundance that you're entering into instead of what you might do without.
Number 9, don't sweat this. You've got this. Take it one step at a time. If you find that you've eaten something that isn't vegan, don't worry about it. The next time you'll know that ingredient is not vegan. You'll learn so much on this adventure. Be kind to yourself. Be kind to other people. Everybody's really doing their best, and we all will learn together. Every little step we take is part of this bigger journey, and we're all here to help each other, to help the planet, and to help animals.
And number 10, every step eventually makes a mile, right? So whether you decide to fully immerse yourself in plant-based today, or you decide that Mondays you're going to have a plant-based day, or maybe you just decide that for the rest of the next few weeks you're having breakfast and that as the plant-based meal, every step eventually makes a mile. Now, also, you know how in January 1st, we get this excitement around the new year, we have like 365 pages to write into for this new year, right? So I always like to tell my patients that every day is a new day, and we can take that excitement of January 1st into each day as we take on this journey. So make every day your January 1st, and we hope you join us today.